What if I can't access a sputum culture for TB diagnosis? Imagine needing a test to find, if you have tuberculosis but being unable to produce a sputum sample. This situation can happen for many reasons, like difficulty coughing up mucus or health conditions that limit lung function. Sputum culture is the most accurate way to diagnose TB because it directly detects the bacteria causing the disease. But when it's not possible to get a good sample, healthcare providers turn to other options to help identify TB. One promising alternative is saliva testing. Recent research shows that saliva can sometimes be used instead of sputum. This involves collecting saliva and using advanced techniques like polymerase chain reaction tests to look for the DNA of Mycobacterium tuberculosis, the bacteria that causes TB. While saliva testing is still being studied, it offers a less invasive way to gather diagnostic information, especially for people who find it hard to cough up sputum. However, more research is needed to confirm how reliable and sensitive this method is across different populations. Another option is stool testing. Since some swallowed sputum can contain TB bacteria, testing stool samples might reveal the presence of the bacteria. This method is especially useful for people who cannot produce sputum, such as young children, people with HIV, or those with extrapulmonary TB, which affects parts of the body other than the lungs. Stool testing is non-invasive and easier to perform, but it also requires further validation to ensure it accurately detects TB in various groups. In addition to these, traditional tests like smear microscopy and newer rapid tests, such as the expert MTB-RIF assay, are also used. These tests can give quick results and are helpful when sputum samples are unavailable. They are often used alongside other diagnostic tools to improve accuracy. If you find yourself unable to produce sputum for testing, it is very important to speak with healthcare professionals. They can evaluate your specific situation and recommend the best alternative diagnostic methods available in your area. Remember, no single test is perfect, and diagnosis often involves a combination of clinical evaluation and laboratory testing. In summary, while sputum culture remains the gold standard for TB diagnosis, alternative methods like saliva and stool testing are being developed and refined. These options can help ensure that more people get the diagnosis they need, even when sputum samples are hard to obtain. Always consult with your healthcare provider to explore the most appropriate testing options for your health and situation.